Hi, my name is Kristal Torres, and I'm going to be talking to you guys about opioids. So, know the facts. What are opioids? So, opioids are basically pain relieving drugs, and they're also known as analgesics. It is a drug class that are also referred to as narcotics. And there are two types of opioids. There are the naturally occurring ones that are derived from the opium poppy plant, and there are also the synthetic opioids known as opiates that are created to mimic the effects of regular ones. So, the ones that I'm going to go over first are the natural physician prescribed opioids that include morphine, codeine, and opium. And moving on to the synthetic legally prescribed ones, this includes fentanyl, tramadol, methadone, oxycodone, and hydrocodone. Then we have the illegal non prescribed ones, which are really dangerous and pose a lot of risk, that include heroin and heroin laced with fentanyl. So, there are many short term and long term psychological and physical effects in the body that opioids do have. So, the short term effects that opioids can take are drowsiness, confusion, nausea, constipation, high like feeling like euphoria, which are basically when endorphins like dopamine are released in your brain, and this causes lots of feeling of pleasure. Then we have the another short-term effect is slowed respiratory rate, and this is when your breathing is very slowed and shallow, and this can lead to hypoxia. And hypoxia is when you have low oxygen saturation in your body due to your slowed breathing rate, and this can possibly be fatal if left untreated. Moving on to the long-term effects that opioids have are they include physical dependence and addiction. And when talking about physical dependence and addiction, it is really important to discuss the withdrawal of opioids. The symptoms are very challenging and painful, and oftentimes opioid users relapse after withdrawal just because it's really, really hard to stop the craving of it. So this is a diagram and picture that's just showcasing the effects of opioids and that it has in the body and how it can affect so many things that you need in order to survive. So it can affect your blood, your brain, your digestive system, your nervous system, your heart, your respiratory system, your liver, and your immune system. So there are many risks of incorrect opioid use, and some of the most biggest and worst ones out there are addiction, higher tolerance, dependence, and this can stem from feelings of calmness and pleasure that leave people craving and wanting more. This is why opioids are very, very extremely addictive, and they have long lasting physical and psychological effects that can cause dependence. So, going off of this, opioid dependence can happen just after 5 days. Yes, just after 5 days. This is really, really quick, and this is why opioids are really, really dangerous and can cause lots of risk because you can become dependent on it very quickly, maybe just even after one use. So, opioids are often prescribed to patients by doctors for situations like car accidents, surgeries, and controlling acute pain. Due to this, both illegal opioids and legally physician prescribed opioids are heavily addictive and can have devastating effects on a person, whether it has to do with health or just their personal life. So, I'm going to give you guys an example scenario. So, let's say you get into a car accident. You get really bad whiplash, and you also have musculoskeletal pain. And because of this, you go to the ER and you go visit a physician. This physician then prescribes you to take an opioid to manage your pain and for pain relief. 5 days later, you are addicted to opioids and very, very dependent on it. When just 5 days ago, you're perfectly fine. Because of this addictive nature, this is why it's safer to take other routes for pain relief, like going to go see a chiropractor, maybe go see a physical therapist, or even just taking other alternative medications or drugs. So the opioid crisis in America is something that's really, really real and prevalent today. Physician-prescribed prescriptions are often given out in many circumstances, such as surgery, acute pain, and car accidents. And the opioids are really controversial to give out today because people feel that they're given out too easily and too often. And opioids are often misused and are stolen or sold in the streets after it is prescribed. This drug class contributes to the majority of deaths due to overdoses, and every 15 minutes, someone dies from an overdose of opioids. Opioid overdoses have caused more than 42,000 deaths in 2016, as reported by the U.S. Department of Health and Human Services. And almost half of opioid overdoses were from a prescription by a physician. So, um, Opioids aren't usually talked about among college students, but they actually are quite common. So, 1 in 4 college students engage in the use of opioids for non medical purposes, and a lot of college students actually misuse the drug, even though it's not really talked about that often. So, more consequences. So, there are both mental and physical devastating repercussions of opioid use if it progresses into an issue. These consequences can be varied by factors such as a person's health, how much is taken, or even happen after just one use. So, consequences can include abnormal sense of pleasure, like let's say your pleasure for food or for sex. You can get higher stress levels. You could have alterations in your decision making, your memory, and your ability to learn. And to the right, we have a picture of before and after heroin addiction, and you can see these people have changed quite a bit just after being addicted to the opioid known as heroin. So more consequences. Yes, there's more consequences of opioid use. So when becoming addicted to a drug such as opioids, you can have many losses in your personal life. So let's say your relationships with your parents start to deteriorate, your siblings, your family members, even your friends. You start to lose things that you valued a lot, so your prized possessions. You can lose your beloved pets, your job, your career, your hobbies, and even your health. So withdrawal. So withdrawal is something that should be talked about a lot when talking about the misuse of opioid. Withdrawal is when heavy use of a drug is cut back after a few or more weeks. Symptoms can occur just after hours after the last dose. Symptoms can last for weeks and are extremely uncomfortable and very painful. Going through withdrawal without medical professional help can often lead to relapse, so it is always suggested that you always seek out professional help. And the withdrawal symptoms include stomach cramps, nausea, vomiting, diarrhea, goosebumps, muscle cramping, depression, agitation, and anxiety, just to name a few. And as you can see in the flyer to the right, it is really just questioning, is it really worth it? Is all the withdrawal, all the pain, and all the suffering of this drug really worth it? And remember, it only takes a little. So, should you consider taking opioids? Always consult with the physician for safety reasons, because it is known that it is very an addictive drug. So, always consult if you have any concerns about it. Is it necessary and or appropriate for your own pain management or relief? Are there any routes for pain relief and management? Like I said before, going to go see a chiropractor, maybe taking other medications, and is it really worth the risk when you could just say no? Thank you.